Everybody, it's Cam Buckner, candidate for mayor of Chicago, and I'm super excited that today we get to roll out our mental health plan for the city of Chicago. And the first thing we will do is to reopen the clinics that have been closed over the years. I'm standing here in the back of the Yards neighborhood, adjacent to where a clinic used to exist for many years and it no longer exists. We need to make sure that we put clinics in the places that need them the most, and so we'll do that work. Secondly, a number of these clinics have to be 24-hour resource centers so that people can walk in no matter what time of the day or night it is and have the ability to get seen and to get the resources that they need. We'll make sure we coordinate with the Chicago Public School System so that our young people have the ability to get their resources. Also invest in a robust mental health responder model, not a co-responder model, but a responder model. I'm reminded of December 26, 2015, the day that Antonio LeGrier was having a mental health episode and called the police on himself, called 911 on himself. The people who showed up at his house that day should not have been cops. It should have been mental health professionals. And if that was the case, he would still be alive. And Betty Jones, his next door neighbor who lost her life, would still be alive today too. And so we're going to take that very seriously. What this pandemic has taught many Chicagoans is that it's okay to hurt. It's okay to deal with trauma. But what we have not committed to is that it's also okay for us to heal, for us to give people the proper resources that they need in order to deal with mental health issues and mental health crises. We have not given people the ability to do that in an appropriate way. I'm standing here in front of what was formerly a Chicago Department of Public Health mental health clinic in Logan Square on the corner of Milwaukee and Medill. And there, at one point, were 21 of these around the city. Unfortunately, we have divested in our mental health, and we've made our city less safe and less healthy because of it. Our men and women in law enforcement are answering way too many mental health crisis calls. They need to be answering calls about crimes, calls about violence, instead of these calls that should be picked up by folks who are mental health professionals. We got to commit to doing the work and putting the resources where they belong to make sure that we can heal this city.